Hello everyone, it's Dr. Nirav Pandya. A lot of 49ers fans have questions about Brock Purdy's ulnar collateral ligament injury that he suffered in yesterday's game. Here's a quick breakdown of the anatomy, what the various treatment options are, and what the return to play timelines are for an injury like this. Now, the first important thing to understand is that the UCL is one of the stabilizers of the elbow. It's particularly important for activities such as throwing. If you look at this model of the elbow over here, it's this thick band of tissue that runs on the inside part of the elbow. And what the ulnar collateral ligament essentially does is basically prevent the elbow from gapping open like this. Now, when an athlete suffers an ulnar collateral ligament injury, besides history and physical exam, and also making sure there isn't a fracture, typically an MRI is performed to look at the degree of injury to the ligament, where the ligament is actually injured in terms of its anatomic position, and then determining treatment options. Now, in terms of what we look for on MRI, a ligament can basically injure, particularly the ulnar collateral ligament, in a couple of different locations. What we're really looking for is the grading of the injury. Grade 1 would be a microscopic tear, grade 2 would be a partial tear, and grade 3 would be a complete tear. It's also important to understand it's not just necessarily the degree of tearing, but where that tear may be located, as well as the overall quality of the ligament itself when you actually look at the MRI. Now, for most grade 1 and grade 2 injuries to the ligament, these are typically treated non-operatively, and these usually involve 6 to 12 weeks of rehab and return to play. Now, if an athlete has suffered a grade 3 injury, and particularly if they're a throwing athlete, or if they have an unstable elbow, or if they're play basically a sport where they're having continuing pain in that elbow even after rehab, then typically surgery is undertaken. Now, there are basically two main types of surgery that can be done. The first type of surgery is ulnar collateral ligament repair. This is not a Tommy John surgery. What you're doing in these type of surgeries is basically repairing the tissue that's there, number one, because either it's pulled off the bone, or number two, it's of good quality, and then using potentially some sort of augmentation, either a suture or some other material around that ligament to basically allow it to heal properly and allow early return to play. Now, this is typically done in individuals who have a traumatic event, meaning the ligament itself doesn't have much degeneration in it, and you basically have good quality tissue that can be put back together or is in a location that will heal very well. The typical return to play timeline for something like this is typically around 6 months. The second type of surgery that can be done is an ulnar collateral ligament reconstruction. This is their Tommy John surgery. Now, what this basically entails is basically taking another piece of tissue, whether it's your own tissue or cadaver tissue, and basically placing it inside the elbow and replacing the ligament. This is typically what you see in pitchers, because in pitchers, there's so much more force across the elbow. In addition, the mechanics are different. And thirdly, there's a lot more degeneration of that tendon from pitching for long periods of the time. So whereas a quarterback may have a traumatic injury where that ligament may actually be of very good quality, in a pitcher, that ligament may be so degenerated that you need to basically reconstruct it or replace it by putting a new ligament inside there. The typical recovery for that is 9 to 12 months. Now, unlike ACL tears, there's a lot of nuance in terms of treating UCL injuries. There can be a lot of differing opinions on different surgeons based on whether you treat this non-operatively, whether you need a repair or a reconstruction. Here's hoping to a quick recovery for Brock Purdy, and hopefully he'll get a good strong elbow and be back for the 49ers next season. Thank you.